Hello there, happy July 7th. So the other day I got the opportunity to shadow at a medicine place where they do a lot of different things. And one of those things is they do injections for people who have pain. So I got to shadow Dr. Gray around and it was great. Saw a couple people get injected for shoulder, subacromial bursitis, AC joint. One person got a carpal tunnel block. Another person had some knee arthritis and they did an injection for that. So it was actually pretty cool, pretty interesting. I got to ask Dr. Ray a lot of questions and he was able to answer those. When to refer people for injections, when not, who would be appropriate, what conditions, that kind of stuff. So some pretty interesting things I found. As he was describing the procedures to patients, a lot of times they're injecting cortisone, and cortisone is a strong anti-inflammatory. So if there's pain in the joint, stick some cortisone in there. It's going to help alleviate that inflammation, alleviate that pain, assuming that pain is coming from the inflammation. But like I tell my patients all the time, and like he told his patients, is it's not going to fix the problem. It's going to get rid of the pain because that inflammation is reduced. But, and he emphasized this a couple of times, they need to do a rehabilitation program. They need to strengthen the muscles. They need to change the biomechanics of their tissues. So those bursa, or those areas, stop becoming inflamed, stop getting irritated. So it's really interesting. I found maybe 85-90% of stuff he was saying is almost verbatim what I tell my patients that are dealing with some of these similar issues. We're talking about one case where a patient had a frozen shoulder and they actually did some injections for that. They stick in some anti-inflammatory stuff, but then they also stick in saline to try to expand the capsule. And he said they'll do that typically a couple of times, about 2-3 times over several weeks. And that seems to really help alleviate that frozen shoulder from becoming a problem in that acute phase. But again, he really emphasized that this is going to help get that movement, but you got to see your rehab. You got to do your rehab to strengthen it, to continually improve that movement so it gets better. I found it very fascinating that he was emphasizing the injections don't solve the problem. They solve the pain, or at least part of it, but you still need to do that rehab. You still need to get treatment. You still need to get the biomechanics moving and operating right or correctly so this doesn't keep happening to you. Another thing I often tell people is that a lot of times people get lateral hip pain on the side of their hip, and they're told it's bursitis. Of course it's bursitis. Basically, pain on the side of your hip, they call it bursitis a lot of the time. And that is not the case. 90% of the time, it's probably a tendinopathy. So sometimes people will get injections on their hip and it doesn't work. And he was suggesting that that's what the research kind of suggests, is that lateral hip pain typically is from the tendon. So you'll get ultrasound done or some type of imaging. And if there's not a bursitis there, which oftentimes there isn't, an injection is not going to do anything really. It's because it's a tendon problem. I tell people this all the time. And if there is a bursitis, the injection will help, obviously. But a lot of times there's not a bursitis. It's a tendon problem. Got to strengthen those tendons, got to get them stronger. And he's suggesting a bunch of different things: physio, chiropractic, shockwave, laser, all these different modalities we use, obviously, in the office here to alleviate the pain, but also to strengthen those tissues, improve the biomechanics so that stress doesn't keep aggravating the bursa and causing all that pain. Overall, it was a great experience. If you're wondering, can we send for or refer for injections? Yes, of course we can. Don't do it all the time. Most people don't need it, but those people that do, it can be a great adjunctive therapy and can provide a significant amount of relief for the right person, for the right patient, for the right condition. Well, I hope you have a fantastic rest of your day, great weekend, and we'll talk to you next time.